Oncology. Neoplasm. A neoplasm is an abnormal new growth of tissue. Malignant neoplasms, cancers, are likely to spread and cause serious illness or death. Benign neoplasms do not spread and are less harmful. When speaking to patients, doctors generally say growth or tumor. You have a small growth or tumor in the bowel. A lump or swelling is a collection of tissue or fluid which is visible or palpable, can be palpated or felt with the fingers. A lump may be due to neoplasm, but there are other causes such as inflammation or fluid accumulation. Patient says, I have a lump on my left breast. Doctor says there was a firm palpable mass in the liver. Malignant tumors are characterized by rapid growth and invasiveness. The tumor may invade local tissues or may spread to distant parts of the body. Metastasis. Neoplasms, which are the result of metastasis, are called secondaries, as opposed to the original tumor, which is the primary. We have the result of the scan back now, and I'm afraid they show that you have a small growth in the prostate. Fortunately, it appears to be at an early stage and there is no sign of a spread. So if we remove it, there is every chance of complete cure. No. To invade is to enter and spread throughout a part of the body. And process is invasion. If a tumor describes an invasive, it has ability to spread. Symptoms and signs of malignancy. The symptoms of malignant disease may be related to the size and location of the tumor. For example, a spatial population in the brain causes raised intracranial pressure and symptoms such as headache, vomiting, or visual disturbance. Tumors of the colon may obstruct the lumen and cause change in bowel habit. Other possible symptoms of malignancy include bleeding, pain, and weight loss. Case 54, 45, 55. A 3-year-old man represented to his GP complaining of a painless lump on the right side of his neck, which had been present for about 2 months and was enlarging. He had been feeling generally unwell and had lost about 5 kg in weight. He was also complaining of night sweats. He had no significant past medical history. Treatment of tumors. A tumor can sometimes be completely removed or excised by surgery. If that's not possible, for example, if it's already metastasis to other parts of the body, it may be possible to destroy by radiotherapy or by chemotherapy. When a cure is not possible, palliative treatment is given, which is only intended to relieve symptoms. Oncología, neoplasias. Una neoplasia es un crecimiento normal de tejido. Las neoplasias malignas, cánceres, son más propensas a diseminarse y causar enfermedad grave o muerte. Las neoplasias benignas no se diseminan y son menos dañinas. Cuando hablan con pacientes, los médicos suelen decir crecimiento o tumor. Paciente tiene un pequeño crecimiento o tumor en el intestino. Un bulto de hinchazón es una acumulación de tejido líquido que es visible o palpable, es decir, que puede palparse en los dedos. Un bulto puede deberse a una neoplasia, eh, pero también inflamación o acumulación de líquido. Los pacientes dicen, tengo un bulto en mi mama izquierda. Médicos dicen, había una masa firme y palpable en el hígado. Los tumores malignos se caracterizan por el crecimiento rápido e invasividad. El tumor puede invadir los tejidos cercanos o diseminarse a otras partes del cuerpo, eh, llamado metástasis. Las neoplasias son el resultado de una metástasis, se llaman secundarias. El tumor original es el primario. Ejemplo médico. Los resultados muestran un pequeño crecimiento en la próstata, parece estar en una etapa temprana y no hay señales de diseminación. Si lo removemos, Hay muchas posibilidades de una cura completa. Nota, invadir, entrar y expandirse dentro de un tejido o órgano. Si un tumor es invasivo, tiene la capacidad de diseminarse. Síntomas y signos de malignidad. Los síntomas del cáncer dependen del tamaño y la localización del tumor. Ejemplo, un tumor ocupante de espacio en el cerebro puede causar aumento de presión intercraneal, dolor de cabeza, vómitos y alteraciones visuales. Tumores del colon pueden obstruir el lumen y cambiar el apetito intestinal, el hábito intestinal. Otros síntomas posibles: sangrado, dolor, pérdida de peso. Eh, Caso 55. Un hombre de 36 años acude al médico por un bulto indoloro en el costado derecho del cuello, presente por 2 meses y agrandándose. Se sentía mal de forma general y había perdido unos 5 kilogramos. También tenía sudores nocturnos, no tenía antecedentes médicos importantes. Tratamientos de tumores. Un tumor maligno se cura si se extirpa completamente mediante cirugía. Si no es posible destruirlo así, se usa radioterapia o quimioterapia. Cuando la cura no es posible, se da tratamiento paliativo que solo busca aliviar los síntomas. Complete the table with words. With cure, curative. Exercise, excision. Grow, growth, growing. Involve, invasion, invasive. Obstruction, obstructive. Palliative, palliation, palliative. Palpate, palpation, palpable. Spread, spread, spreading. Swell, swelling, swelling or swelling. The notes below are about the patient described and be opposite. We use them to put the sentence in the correct order. 1. 6. 6.1. On examination, his temperature was 37.8 degrees Celsius. 3 is 2. There was a small firm 3.4 cm mass in the right supraclavicular fossa. 7. 3. There were enlarged lymph nodes in both axillary and inguinal areas. 2. 4. His mouth and throat were normal. 8. 5. His pulse rate was 100 min regular and blood pressure 112 above 566. 5.7. On abdominal examination, there was a mass palpable below the left costal margin. 1 is A. Examination of the central nervous system was normal. Complete the sentence. 1. Distant spread of tumor cells is known as metastasis. Many symptoms of cancer, such as difficulty swallowing, are due to obstruction. The opposite of painful is painless. A malignant neoplasm is called a cancer. Tumors which do not invade or metastasize are benign. Secondary tumors are those which result from the spread of a primary. If a cure is not possible, palliative treatment should be given. A palpable liver suggests metastasis.